In this class, we learn about atherosclerosis. And this atherosclerosis is predominantly an asymptomatic condition where the patient won't experience symptoms, and it is a major cause for cardiovascular diseases. And for atherosclerosis to occur, the major culprit is a LDL molecule which carries cholesterol from liver to other cells. Whenever these LDL levels increase, that is, normal LDL level in the blood is should be less than 100 milligrams per deciliter. Whenever these levels increase, if it is greater than 100 milligrams per deciliter, whenever LDL levels are increased, then there will be a deposition of LDL in the blood vessels, and they will cause atherosclerosis. There are series of multiple events which occur in the formation of atherosclerosis. We'll see that. And the blood vessel contains three layers. One is tunica adventitia. This is called as adventitia. And middle layer is tunica media. And one more layer is tunica intima. And the deposition of LDL will occur here. This is media, intima. So, subintimal layer deposition of LDL will occur. So, this series of events are classified into three types or three phases. One is formation of fatty streaks. Second one is formation of fibrous plaque. Third one is formation of advanced or complicated lesion. Now we'll see each event. First one is formation of foam cells and fatty streaks. The risk factors for formation of atherosclerosis are: one is hypertension, second one is hyperlipidemia, third one is smoking, one more is diabetes mellitus. And these conditions will cause endothelial injury. And this is an endothelium. This is endothelium and this is the lumen. This is a lumen. So where the blood flow and LDL is present here. Whenever there is an injury, there is a separation of endothelium. Endothelial injury causes separation of endothelial. They create a space between the endothelial cells, and there is movement of monocytes. Okay, monocytes from blood into the subendothelial space. This is subendothelial space. Subendothelial space. So here we have LDL molecules, and monocytes when move into the subendothelial space, and they are converted into macrophages. Okay, and due to the gap creation, this LDL molecule will also move from endo inside the lumen to the endothelium. So we have here macrophages. These are the macrophages, and LDL has also moved from the lumen. LDL also moved from lumen into the subendothelial space. These are the LDL molecules. And when LDL molecules have moved into the subendothelial space, and they will be trapped inside inside the subendothelial space by proteoglycans. So what will happen? LDL molecules are trapped by proteoglycans. Proteoglycans. And this LDL molecule, trapped LDL molecules, will undergo modification. And this modification is, these are the normal LDL molecules, and these are modified into oxidized LDL. Oxidized. There are reactive oxygen species. So ROS will be there, and these reactive oxygen species will convert normal LDL molecules into oxidized LDL molecules. Oxidized LDL molecules. And these oxidized LDL molecules are taken up by the macrophages. So oxidized LDL molecules are taken up by the macrophages. Macrophages. So what will happen when macrophages are taking up the oxidized LDL molecules? So this is endothelium. This is subendothelial space. Subendothelial space. And here macrophages are present. These are the macrophages. And here we have oxidized LDL molecules. These are oxidized LDL molecules. These macrophages will take up oxidized LDL molecules, and this is a macrophage molecule, and inside this macrophage we have oxidized LDL molecules. And this uptake of LDL molecules by macrophages is a non-regulated process. So uptake of LDL molecules by macrophages is an unregulated process. Normally the LDL molecules taken up by the cells is a regulated one, but by macrophages it is an unregulated process. So what will happen? The macrophages can take up lot of LDL molecules, and this process is called as a scavenger mediated mechanism, scavenger mediated mechanism. So LDL absorption can takes place through receptor mediated mechanism, which is a regulated one, and LDL molecules can taken up by the macrophages through an unregulated process that is called as a scavenger mediated mechanism, which is a major culprit for atherosclerosis. Atherosclerosis. So by taking up the LDL molecules by the macrophages, and these are called as a lipid laden macrophages. These are lipid laden macrophages, and because of presence of lipid in the macrophages, these lipid laden macrophages are called as foam cells. So this is the first step. So the foam cells are formed, and like this there are macrophages lot of macrophages with lipid LDL molecules, and these foam cells will accumulate in the subendothelial space, and they will form a fatty streak. They will form a fatty streak. And these fatty streaks, they do not obstruct blood flow. They do not obstruct blood flow. So this process will continue, and this foam cells, so next is we'll see the next event, that is formation of fibrous cap. Fibrous cap. Now this endothelium is there, we'll see the further process how fibrous cap is formed. Okay, so we have foam cells. So there will be lot of foam cells deposited in the subendothelial space, and there will be lot of LDL molecule inside the macrophages which have taken up through an unregulated process. They can take lot of LDL molecules. There is no regulation. And these foam cells, what they'll do, these are the foam cells. They promote further oxidative stress. They'll promote the oxidative stress, and this oxidative stress cause releasing of inflammatory mediators. They'll release these inflammatory mediators are cytokines and chemokines. And this inflammatory mediators, what they will do, this is one layer where smooth muscle cells are present. These are the smooth muscle cells. So chemokines are there. What it will do, chemokines and this inflammatory mediators, they'll cause recruitment of platelet derived growth factor, PDGF, and insulin like growth factor, and these will cause migration of, they cause migration, this is migration of smooth muscle cells, migration of smooth muscle cells, and these smooth muscle cells will migrate to here and they are deposited here like this. These are the smooth cells, and smooth muscle cells will cover the foam cells, cover the foam cells, and apart from the smooth cells, extracellular matrix will also be proliferated here. So there will be an extracellular matrix. This is extracellular matrix will be deposited here, and this extra matrix will have dendritic cells, and these smooth muscle cells will secrete collagen. These smooth muscle cells will secrete collagen, and this dendritic cells, smooth muscle cells, and collagen, they will form a fibrous cap. So these are smooth muscle cells. So smooth muscle cells which secrete collagen, along with the collagen dendritic cells are there, and they will form a fibrous cap. So this is a cap and this is core. The core will have fatty streak and foam cells. Fatty streak is formed by the foam cells, and this fibrous cap, what it will do, this fibrous cap, they'll act as a shield. They act as a shield so that they'll protect the plaque. They protect the plaque from bloodstream. Okay, and this is called as a atheromatous plaque. This is called as an atheromatous plaque. And here, this atheromatous plaque, there will be deposition of calcium. There will be deposition of calcium here. This is calcium deposition. So this in a long-term condition, this atheromatous plaque will be calcified. Whenever you do CT scan for heart, you can see these calcified lesions. And now we'll see the third event, that is formation of complicated lesions. And these atheromatous plaque have two conditions. They can be stable or they can be unstable. These stable plaques are firmly attached to the subintimal space. And fibrous cap, this is one point, this is second point. Fibrous cap which is thick, and this fibrous cap will rupture resist rupture. And this unstable plaques, they are prone to rupture. How this rupture will occur? These activated macrophages, they will secrete metalloproteinases and collagenases. These metalloproteinases and collagenases, they will break down fibrous cap. They'll break down the fibrous cap. So this breakdown of this collagen will be diluted. They'll be broken down into simpler structures. So this fibrous cap will be becoming weak. So this fibrous cap will become weak. So this fibrous cap will become weak and it will become thin. The thin fibrous cap, due to the blood flow, they will rupture. So thin fibrous cap, they will rupture. So when this fibrous, this is a cap, and here are the foam cells. This is a thick fibrous cap. Due to collagenases, due to metalloproteinases and collagenases, the fibers become thin, easily broken down, and the rupture. This rupture, there is a breakdown, and these foam cells are exposed to the blood. So blood will contain platelets. So here this is a lumen. Here there is a rupture of the fibrous cap. In this we have platelets, and these platelets will come in contact with the foam cells. This plaque will come in contact with the foam cells, and the platelets will form a platelet aggregation. This rupture will cause platelet aggregation. And platelet aggregation will cause thrombus formation. So this is a blood vessel, and there is a formation of atheromatous plaque. So there is a narrowing of the blood flow to the tissues, and further rupture of this fibrous cap causes thrombus formation. Like this, thrombus is formed, and there is further occlusion to the blood flow in the blood vessel. So this thrombus formation causes occlusion of artery. This occlusion of artery will lead to ischemia and necrosis of tissue. So this atherosclerosis will occur in the major blood vessels: coronary arteries, popliteal artery, popliteal arteries, femoral arteries, aorta, brain vessels. All these are prone for atherosclerosis. So all these tissues undergo ischemia and necrosis. If coronary arteries are occluded, then we'll get myocardial infarction. Myocardial infarction. Sometimes in aorta, this atherosclerosis will cause aneurysms because the vessel walls will be damaged, and because of the blood flow, they will form aneurysms. Aneurysms. So this is the process how atherosclerosis will occur and causes myocardial infarction. And you can reverse some of the events like foam cell formation, and fatty streak events, and fibrous cap formation. They can be reversed with lifestyle modification by doing exercise at least 90 to that is walking 90 to 150 minutes of exercise has to be done. And if smoking is there, stop smoking, and you can decrease fat intake, that is especially saturated fats, and you can use drugs for lowering LDL levels. This is how you can reverse atherosclerosis. Only these events. Once there is a thinning and complete formation of plaque, you can't reverse. That is complicated lesions, you can't reverse it. Before that, you can reverse with a lifestyle modification. If you are a smoker, you can stop smoking, and if it is if you are taking a lot of saturated fats, you have to decrease and you have to do exercise. And if there is anything, you can use drugs. If it is not controlled by all these things, you can use drugs which lower LDL levels. So this ends the atherosclerosis. Thank you.